In just a moment, we will be joined by a young woman who has had a very scary year. Her name is Heather Sherba. She's 22 years old. She had just graduated from nursing school and was working on getting licensed in her home state of Pennsylvania when on August 4th, she went to work out at the LA Fitness Club in Collier Township, which is just outside of Pittsburgh, Pennsylvania. And a man named George Sodini walked into that gym that day. He turned off the lights in the aerobics room and he opened fire. He killed 3 people and he injured 9 others before he killed himself. Heather Sherba was hit twice. One bullet ricocheted off her front tooth. Another went through her leg. She spent 5 days in the hospital. She still goes to physical therapy 3 times a week. At the time of the shooting, Heather did not have health insurance. She was a recent college graduate. She was still looking for her first job as a nurse. You might remember that we did a brief story on this show about how Heather's friends held a car wash to help raise money for her medical bills. Because of the attention that Heather's story got, because of how she was hurt, because of the car wash fundraiser, and because of media coverage of the car wash fundraiser.
I'm just absolutely grateful that everybody that is supportive of me and has come out and willing to have a helping hand in raising money for me.
Because of news stories like that one, which aired locally and on this show, Pennsylvania Governor Ed Rendell took notice and decided to step in to help. The first idea from the governor's office for how Heather could get health insurance was a new provision, one the governor had just signed into law in June, which allows Pennsylvania residents to stay on their parents' health insurance until they're 30 years old. But Heather told the governor's staff that would not work for her because her father passed away a couple of years ago and her mother is uninsured, just like Heather. So then it was back to the drawing board. Ultimately, because of the specific circumstances of Heather's case, this unexpected short-term disability, Governor Rendell's office was able to help Heather get temporary coverage under a public health plan that's called Unison. So thankfully, Heather is now getting government-sponsored health care, and her medical bills are being paid. Getting health insurance is a happy outcome for Heather Sherba, but consider for a second how it happened. It happened because she was hurt during a very tragic, very newsworthy event. Because of that, her story became local news. Once it became local news, it by chance became national news on this program, and it thereby got the attention of her state's governor. And there does exist a fragile, incomplete web of government-sponsored fallback health insurance. And these programs exist because we as a country believe that government-run healthcare programs work, that they can solve problems that really need solving for people who fall through the cracks of the private insurance system. And right now in this country, we are facing a very clear, very important choice. We could just hope that all these individual, hard-to-find, harder-to-navigate niche programs with their really specific qualification requirements will fill in every single crack you can fall through between the hodgepodge of expensive and dissatisfying options offered by the private insurance industry. We could hope for that. And if you're ever in a situation, God forbid, like Heather's, you can hope your story makes it onto TV while your governor is watching. Or we could decide to have a broad public health insurance option available to everyone. So if private insurance doesn't work for someone for any reason, there's another choice, one that is affordable and that anyone can sign up for. It's a really tough choice, right? Joining us now is Heather Sherba. Heather, thanks very much for coming on the show and being willing to talk about your story.
Thank you. Thanks for having me.
First, I have to ask you, how's your recovery coming along?
So far, so good, and taking it one day at a time, but I can't complain too much, so...
Well, a lot of people could complain in your situation, so that says a lot about you. I know that you spent 5 days in the hospital. You're still going through physical therapy. What kinds of medical bills were you looking at around the time that your friends decided to have that car wash fundraiser for you?
Actually, I didn't receive any as of yet. The only ones I did receive in the mail was just the ambulance bill and then like a consult from one of the doctors I had received in the hospital. I think the hospital was waiting to issue me an itemized bill and to see if I was going to be approved by medical assistance first to see what the next step was going to be.
And you had been on medical assistance before, but you had aged out of that program, right?
Right.
Yeah. Before the governor's office stepped in and awaiting that, what you figured was going to be the bill ultimately from the hospital, what sort of options did you think you might have? What were your plans?
Well, to be honest with you, at first I didn't have any idea, but after a social worker had come and talked to me into the hospital, they had explained that there is an organization known as the Center for Victims of Violent Crime, and also they wanted me to reapply for medical assistance. And then I believe certain hospitals have like a charity care or something that can help pick up a bill for whatever isn't paid for if you do qualify for it.
So you were going to try to use those various systems to try to sort of cobble something together.
Right. There's a lot of documentation and a lot of things that you have to send in to show proof, of course.
Now, your mom isn't insured right now at the moment either. What's your mom doing for insurance?
Well, as of right now, I'm not exactly sure, but I know she did apply for something in the past, and the wait list was very long. I don't remember what insurance company that was for, but she just is paying out of pocket for right now.
The coverage that Governor Rendell's office helped you find, I understand it's contingent on the fact, essentially it's contingent on your injury. It's contingent on the fact that you're considered temporarily disabled. And so since it's temporary, do you know how long you'll be able to keep that coverage?
I'm not so sure. I actually had just found all this information recently. I still have a couple of phone calls to make with a couple of people and caseworkers to see how long this is going to last and everything. I'm not exactly sure on that.
How's the job search going? I know that you've been in nursing school.
It's becoming tedious and frustrating, but I'm still trying. So
I understand.
With the way the economy is lately, I guess it's just hard for anyone, and especially with not having any experience under my belt. It's not so easy, but I'm working on it. Hopefully something will happen sometime soon.
Well, maybe right now you've had some luck with being on TV, so maybe somebody's seeing you right now thinking about it. You need a nursing job for a starting nurse with some very unusual experience, and it should have health insurance.
Yeah.
Right? Those are the qualities we're looking for. Heather Sherba, thank you so much for joining us tonight. Good luck with your recovery, and good luck with the start of your career. Good luck to you.
Thank you.
Okay, the internecine warfare between Sarah Palin and the people who worked with Sarah Palin on her campaign to be vice president, that internecine warfare continues, and it's getting even more awkward. The McCain-Palin campaign manager just made a public, devastating assessment of Sarah Palin's inevitable run for president. That is coming up. And I honestly wouldn't keep mentioning it if I weren't sure about it, but you have had a long week. I'm sure you owe it to yourself to see tonight's Moment of Geek. Whether or not you are a geek, just trust me, there is a money-back guarantee on this one.